Welcome to this Autism Ontario webinar. My name is Matthew Lane. As always, I will be your host. Today, the title of the broadcast is The Essentials of Raising a Human Being. And it's my pleasure to welcome back to the desk. It's been some time since we've spoken with Dr. Ross Greene, who is the founding director of Lives in the Balance and served on the faculty at Harvard Medical School for over 20 years. He is now the adjunct professor in the Department of Psychology at Virginia Tech, an adjunct professor in the Faculty of Sciences at the University of Technology in Sydney, Australia. With the release of his most recent book, Raising Human Beings, Dr. Greene has turned his attention to all kids, with a particular focus on teaching the skills that define the better side of human nature. That's empathy, appreciating how one's behavior is affecting others, resolving disagreements without conflict, and taking another's perspective honestly. So I'd like to welcome back Dr. Greene. Dr. Greene, it's nice to have you here.
Thanks for inviting me to do this.
Not a problem. For our audience, if you've never been here before, my job is to get you answers to your questions. So throughout the broadcast, feel free to submit your questions in the Ask a Question box, and we will try to get all of your questions answered. We do have over 300 people registered, so we may not get to them all, but we will find a way of getting back to you after the fact. There's PowerPoint slides to the right of us. That's where you will see what we're talking about. They'll inform our conversation and a bunch of resources that I'll be talking about throughout the day in the handout section just below the slides. If you have any issues, go ahead and click the help button. So Dr. Greene, why is this an important topic right now? Why do you believe that Autism Ontario brought you to the table to speak to our audience today?
Well, I don't want to speak for Autism Ontario, but my sense is that people do feel that my work on how to solve problems with kids is very relevant. I've always been, for the last 9 months, I've been saying it was relevant before the pandemic, it's relevant during the pandemic, and it will be relevant after the pandemic. I would say that because parents and kids are suffering right now, little bit too much togetherness, not enough alone time for many people, the people living on top of each other. I would say that this would be a really good time for people to know how to solve problems collaboratively and proactively.
Okay, I would imagine the same, but we're not going to be, in your presentation today, as you said, it's about all times, right? It's not specifically about the pandemic. We're going to be focusing on those skills and the like. Okay, well, let's start with a background, if you may, giving us a bit of a background about the approach and about what we're going to be sort of discussing today.
Well, the first thing, among the things we're going to be talking about are power, which is an ingredient caregivers often use to try to influence their kids' outcomes. Not an ingredient that I'm particularly keen on, especially since I think there's a better way to do things, and that's collaboration. I don't think power teaches the skills that define the better side of human nature. I think collaboration does. And so just that topic alone should get us through a good 40 to 45 minutes.
Right. Okay, so you got some slides prepared for us, and you know, in this first one, we're talking specifically about autism and power. So why don't you dive into that, please?
You bet. So by mere virtue of the core features of autism spectrum disorders, kids who are diagnosed with an autism spectrum disorder have more difficulty meeting more expectations. The world was not designed around autism. And so if you do have some of the difficulties that often present themselves in kids who are diagnosed with autism spectrum disorders, you're going to bump up against the world sometimes and the world's expectations, many of which may be more difficult for you to meet. Now, that would not be so terrible if it wasn't for the fact that many caregivers tend to respond to those unmet expectations with what we might call power and control methodologies. And that's not just true in the case of kids with autism spectrum disorders. It's true in the case of all kids. But if you're having difficulty meeting more expectations, and adults are using power and control to try to get you to meet those expectations, then it stands to reason that kids with autism spectrum disorders, as well as some other psychiatric diagnoses, are going to run into those power and control methodologies more than other kids are going to. Kids with autism spectrum disorders are sometimes characterized, therefore, as being overcorrected, overdirected, overpunished. That's power and control coming at you. But when are those methodologies primarily used? When a kid is having difficulty meeting certain expectations. Of course, a lot of those methodologies are primarily used in response to the behaviors kids exhibit when they're having difficulty meeting certain expectations. And, you know, rewarding kids for certain behaviors and punishing kids for behaviors we don't like might get the job done when it comes to their behavior. But it's not going to get the job done when it comes to the expectations they're having difficulty meeting that are causing those behaviors. Those are two very different things. The behavior, that's the signal. That's the fever. That's just the means by which the kid is communicating something very important. There's an expectation I'm having difficulty meeting. What we've been doing for a very long time is using behavior modification strategies to modify kids' behaviors. And lo and behold, what did we discover? Those behavior modification strategies might be okay, at least temporarily, at helping change a kid's behavior, but those reward and punishment strategies are not very good at solving the problems that are causing those behaviors. And that may explain why kids on the autism spectrum are so often also diagnosed with something known as oppositional defiant disorder, often anxiety disorders, depressive disorders. Kids are having difficulty meeting more expectations, and a lot of caregivers are responding to those unmet expectations with power and control. And in my opinion, here's the recipe for conflict. So there's the summary on autism and power. We're not going to be talking about power after this slide. That's our intro.
So a couple things. I just heard ODD. I mean, I'm not a psychologist. I'm not in the space, but I just heard about ODD recently. For those on the webinar who aren't aware of oppositional defiant disorder, would you be able to define it for us quickly?
Yeah, well, I'm not a very diagnostically oriented mental health professional, so my quick answer to what are the diagnostic criteria for oppositional defiant disorder would be, I don't really care. But for those who are interested, what we're talking about here is kids who are refusing to do as they're told, defying adult rules and requests, throwing more tantrums than the average kid. Roughly, that's oppositional defiant disorder.
Okay. And you had mentioned that collaboration is the key, but the way that we have been treating it up until now, or one of the ways that we commonly treat it, isn't working. There's negative repercussions of that. What are the negative repercussions of doing it the other way?
Well, and I'm not saying that the other way doesn't work. That would be incorrect. There are data telling us that the other way does work, at least temporarily. Durability has been an issue for the other way, the reward and punishment approach.
Right.
But the biggest issue, in my view, is that it causes us to focus on the wrong thing. It causes us to focus on the kid's behavior. The signal, what I refer to as the fever, instead of the problems that are causing those behaviors. And that's what I think we should be focused on for many, many important reasons that I will go into as we go along.
Excellent. Excellent. I got one question from the audience that's relevant to what I said, and then I'll let you get back to it. But does this go against the tenets of ABA therapy, which strongly recommends a reward system to change behavior and promote compliance?
Applied behavior analysis, depending on how the person was trained. Behavior's in the name. Applied behavior analysis. So there are many people, not all, but many people who are trained in ABA who are primarily focused on behavior. And if you are primarily focused on behavior, then you are primarily going to be focused on behavior modification strategies. There we have it again, reward and punishment. I'm not saying ABA doesn't work. I'm saying it's focused on something that I think is later and less important, and I'll explain what I mean by later in a bit, than the problems that are causing those behaviors. For example, let's say a kid is running out of the classroom. That's the behavior. When the kid is having difficulty reading aloud in social studies, if you punish the kid for running out of the classroom or reward the kid for staying in the classroom, you might get the kid to stay in the classroom, maybe yes, maybe no, but you still haven't solved the problem of the kid having difficulty reading in social studies.
Right.
If you solve the problem of the kid having difficulty reading in social studies, not only is that problem solved, I don't think he's got any reason to run out of the classroom anymore.
Makes total sense. Makes total sense.
Makes sense.
Yeah. A reminder to everyone as we move on that you can submit your questions at any time. That was just the first step of that. We'll be getting to questions throughout the presentation, and we will be having some time, hopefully at the end, to handle a bunch of questions. All right, Dr. Greene, on with the presentation.
All right. So power probably explains, at least in my opinion, why the most frequent complaint I get from kids is my parents won't listen to me. The most frequent complaint I get from parents is my kid won't talk to me. When you're rewarding and punishing, there is no conversation. When you're using power, there is not communication. There's just behavior and the consequences that follow that behavior. It feels to me like a very limited approach to trying to help kids. It also would not be expected to teach the skills that foster the better side of human nature. And as you already heard from Matt, what are those skills? I talked about them quite a bit in my most recent book, Raising Human Beings. These are my 5. Empathy. I think when human beings lose their empathy, I'm not sure we qualify anymore. But also appreciating how one's behavior is affecting other people, resolving disagreements in ways without conflict, taking another person's perspective, honesty. When those skills are present, we see the better side of human nature. When those skills are absent, we see the ugly side of human nature. Because of our distant ancestors, all of us human beings are capable of ugliness. We all got some ugly in us. What protects us from our ugly skills? These skills. Now an important question that comes up in another slide are the ways in which we are presently going about teaching, parenting, disciplining our kids, teaching the skills that are on the better side of human nature. I can tell you what the research and my anecdotal experience have been telling me. When you are solving problems in the ways you'll be hearing me describe over the next half an hour, mere process of engaging kids in solving problems collaboratively and proactively enhances the very skills you saw on the last slide. So my answer to, if not, what should we be doing instead, is We should be solving the problems that are causing behavior collaboratively and proactively, rather than relying so heavily on strategies that are merely effective sometimes at modifying the behavior, but are not effective at all at solving the problems that are causing that behavior. All right. What does this involve? In a soundbite, it involves shifting from methodologies that are primarily about power and control to methodologies that are primarily about collaboration and problem solving. Collaboration, not power. Problem solving, not behavior. All right. In raising human beings, I talked about the most important task of life for kids. If you're a kid, your most important task is to figure out who you are. What are your skills, your preferences, your beliefs, your personality traits, your goals, your direction? Get comfortable with it and pursue a life that is congruent with those characteristics. If you ask me as a mental health professional, where do I think we human beings run into trouble? It's when we're trying to live a life that is incongruent with who we are, with our skills, our preferences, our beliefs, our personality traits, our goals, our direction. That's when we human beings get unhappy. That's when we human beings get irritable. That's when we human beings don't feel that good about who we are. Important to get comfortable with who you are. But it's not only about who you are as a kid. I doubt that we have many kids joining in on this webinar. We have caregivers joining in on this webinar. If all we're focused on is who's the kid, then it makes it feel like the parent has been left out, or the caregiver. Nope, you're not left out. We've got this slide. What is your most important task as a caregiver? Figure out who this child is. The child's skills, preferences, beliefs, personality traits, goals, direction. Get comfortable with it and help the child pursue a life that is congruent with it. If you ask me as a mental health professional, when do caregivers and kids run into trouble with each other? It is often when caregivers are trying to mold the kid into something the kid isn't. But now it feels like it's totally about the kid. Do caregivers even have a role in this anymore? Of course you do. You want influence. You want influence because you want the kid to benefit from your wisdom, experience, and values. That's what you're looking for. Influence. The problem, of course, is that if you are trying to gain influence through power and control, you're leaving somebody very important out, the kid. And if you are only paying attention to who the kid is, you're leaving somebody else out, you. It's got to be both. Your kid is who your kid is, but you do want to have influence. How do we caregivers exert influence on kids? Through our expectations. If you as a caregiver feel that it's important to have a clean room, perhaps you've experienced the fact that if the room is messy, there could be rats or mice, then having a clean room is going to be one of your expectations. If your experience as a caregiver tells you that completing homework is important to a kid's ultimate outcome because it might influence the kid's grades and learning, then homework completion is going to be one of your expectations. That's just your experience, wisdom, and values talking. That's all that is. If you feel that you don't really care if your kid's bed is made on a daily basis, and full disclosure, I didn't really care if my kids' beds were made on a daily basis. If they wanted to make their beds, they could make their beds, but I didn't really care if their beds were made. I don't really care if my bed is made. I didn't put that expectation on my kid. Based on my experience, wisdom, and values, I didn't care. One thing I've learned over time as both a parent and a mental health professional is you can't care about everything, but the things you care about have to be a good match with who your kid is and with what your kid is capable of. There's got to be compatibility there. I can buy you influence. We can make sure that your kid benefits from your experience, wisdom, and values, but control and power is not the way you're going to go about doing it. One of the things I also learned as both a parent and a mental health professional is we don't have control. When that's a delusion. It's the delusion that we as caregivers have control. You don't have control. The best I can buy you is influence. And the more control you shoot for, the less control you have. Isn't this interesting? It helps explain a lot of the mistakes we caregivers so often make. You don't want control, you want influence. You're not going to get influence with power. You're going to get influence with collaboration. And if you are collaborative, not only are you gaining influence, you are teaching your child some very important skills. So I've already sort of covered this slide. What determines your child's outcome? Simply the degree of compatibility between your child's characteristics, especially skills, and characteristics of the environment. Now, there are a lot of characteristics of the environment, but I'm going to limit it for the time being to one ingredient, your expectations. When there's compatibility between expectations and the skills a kid has to meet those expectations, we would expect a good outcome. When there's incompatibility between expectations being placed on a kid and the skills the kid has to meet those expectations, there is incompatibility, and we would expect a less optimal outcome. So isn't this interesting? Outcome, and I know there's a lot of factors involved here and I'm oversimplifying. Outcome basically comes down to the expectations we are placing on kids and the skills they have to respond adaptively to those expectations, and how we handle things when kids are having difficulty meeting those expectations. Wow, life is more complicated than that, but not that much more complicated than that. So now here's the summary of what I propose that we do differently, and quite frankly, what I've been doing differently for the last 30 years. We're not going to be focusing on behavior and modifying them. Once again, the behavior is just the signal, just the fever. Hitting is a behavior, kicking is a behavior. I'm the first to acknowledge some behaviors are more serious than others. And for the last 40 years, I've been working with kids who are primarily defined by the fact that these signals they are exhibiting to tell us that they're having difficulty meeting certain expectations are more severe. These days, I refer to those behaviors as unlucky behaviors. Sampling, screaming, swearing, hitting, spitting, kicking, biting, throwing, destroying, running. By contrast, there are also ways of communicating that you're having difficulty meeting certain expectations in ways that are lucky. Using your words, as I refer to it, the holy grail of lucky, especially if they're the right words, but also whining, pouting, sulking, withdrawing, crying. Why are those ways of communicating that you're having difficulty meeting certain expectations lucky? Those ways aren't going to get you popped into timeout. Not going to get you a detention, suspension, expulsion. Not going to get you hit on the butt with a piece of wood. Many Canadians don't know this. Do you know that here in the United States of America, we still hit kids on the butt with a piece of wood in our public schools in 19 of the 50 states, and we do that hundreds of thousands of times every school year? Those lucky ways of communicating that you're having difficulty meeting certain expectations are not going to get you thrown into a locked, padded room, what's known as a seclusion, pinned to the ground by 2 to 4 big adults in what is known as a restraint. But best of all, those lucky ways of communicating that you're having difficulty meeting expectations, those lucky behaviors, are highly likely to elicit empathy from your caregivers and highly likely to be responded to by caregivers with nurturance and support. Not so with the kids I've been working with for the last 40 years, the unlucky ones. Now, by the way, don't get me wrong. I'm not saying that kids who are struggling, but telling us they're struggling in ways that are lucky. They're hurting. They're in pain. The main reason they're lucky is because of how we respond to them. It's those unlucky behaviors that are going to get you put in timeout, detention, suspension, expulsion, hit, pinned, thrown. Even though the field of developmental psychopathology has been telling us for a very long time that irrespective of how you are communicating, that you're having difficulty meeting certain expectations, your behavior is communicating the exact same thing. I'm stuck. There's an expectation I'm having difficulty meeting. I don't want to focus on behavior. It's the byproduct. I don't want to be primarily focused on modifying behavior. That's modifying the byproduct. I want to be primarily focused on the problems that are causing that behavior. I call them unsolved problems, also known as unmet expectations. And I focus on helping caregivers solve those problems collaboratively and proactively. So, how are we going to solve those problems? And Matt, just to give you the heads up, we are about to move into the technical portion of the program. If there are any questions in the queue about the conceptual part of the program, now might not be a bad time for them.
No, we've already got people asking for, what do you do when, or for, those exact strategies. So that may be something that we hold until we get through some of these. Got it. So, but a reminder to everyone is to submit those questions. We will be getting to all of those questions as we go through here.
Got it. All right, then let's jump into the technicalities. How are you going to solve those problems? Well, first, you got to identify them. How do you identify them? Using an instrument that you will find on the website of the nonprofit I founded, Lives in the Balance. I'm sure our friends at Autism Ontario will make sure that you all have that website. We need to make sure that you have that URL because that website is just loaded with free resources to take you beyond everything I'm covering briefly today. Matt, go ahead.
It's all available in the handouts right below the slides. Just scroll down there a bit, guys, and you'll find that as well as some information on Dr. Greene's book and a few other matters.
Super. So the assessment of lagging skills and unsolved problems, those of you who are familiar with it already should know that it has been recently revised to make it quicker and easier to use, is going to help us identify the information that's been missing. What are this kid's lagging skills? So here's the interesting thing. I was speaking at an autism conference in Denmark about 1.5 years ago, and a mom in the audience raised her hand and said, I found my daughter's autism diagnosis to be very useful. I said, good. She said, but I think what you're saying is that my daughter's autism diagnosis didn't tell me what my daughter's specific lagging skills and unsolved problems are. I said, right. So although I know that the autism spectrum disorder diagnosis can be useful for a lot of people, I like to nudge people past the diagnosis. Doesn't matter whether it's the autism spectrum disorder diagnosis or ADHD or oppositional defiant disorder, you name the diagnosis, I'm going to try to nudge people past the label and onto the information that's been missing. What are this kid's lagging skills? What are this kid's unsolved problems? Lagging skills define autism. Unsolved problems tell you when your child is struggling, and also when your child is likely to signal that they are struggling through their behavior. Once those unsolved problems are identified, and by the way, there's a 30-minute video on the Lives in the Balance website to teach you how to use the new ELSA, very much worth watching. You are then ready to start solving problems. And when it comes to solving problems, you have 3 options. And those 3 options are known as Plan A, Plan B, and Plan C. What I've done here is I've taken the many different ways in which we caregivers approach problems with kids, and I've reduced them to 3 basic options. A, B, C. Notice at the top, unsolved is underlined. See, if a problem isn't unsolved, you don't need one of these plans. It's a met expectation. It's not an unsolved problem. So if a kid is brushing their teeth as well and as often as you'd like them to, you don't need a plan. It's not an unsolved problem. It's a met expectation. No plan needed. Kid is doing their homework as well and as often as you'd like them to. You don't need a plan. It's not an unsolved problem. It's a met expectation. You only need one of these plans if a kid is having difficulty reliably meeting an expectation. So just to make sure you're clear, what are some of the more common unsolved problems I help caregivers work on at home? Well, we just named one: difficulty brushing teeth before going to bed at night, difficulty completing a particular homework assignment, difficulty getting off the Xbox to come in for dinner, difficulty getting off the Xbox to do practically any other activity of daily living, difficulty taking out the trash on Tuesday mornings, difficulty being in bed by 9 p.m., difficulty being awake for virtual learning by 7 a.m. Those are common unsolved problems at home. Common unsolved problems at school: difficulty completing the double-digit division problems on the worksheet in math, difficulty sitting next to Trevor during circle time, difficulty getting along with Johnny on the school bus in the morning, difficulty keeping hands to self in line on the way from the classroom to lunch, difficulty coming back into the classroom after recess. I could go on, but you get the basic idea. These are the common expectations kids frequently have difficulty meeting. Now, you might be thinking, those seem pretty mundane. I don't really rank unsolved problems for the degree to which they are mundane or not. I'm solving all of them the same way. Even if it's difficulty practicing safe sex, even if it's difficulty abstaining from use of substances, even if it's difficulty coming in for curfew by midnight, I'm solving them the same way. Even if the kid is 3 years old, even if the kid is 17 years old, even if the kid is 57 years old, I'm solving them the same way. The 3 options are called Plan A, Plan B, and Plan C. Plan C is where you're setting a particular problem aside, at least for now. Many people hear that and they think giving in. Nope, there's no giving in the entire model. Giving up? No, there's no giving up in the entire model. Prioritizing? Yes, there is prioritizing in the collaborative and proactive solutions model. Why do we need to prioritize? Because once you identify all of this child's unsolved problems, there's a decent chance there's going to be a lot of them. And there's a decent chance you're going to try, now that you've identified them, it's very exciting. Now that you've identified them, you're going to try to solve them all in a week, thereby guaranteeing that none of them at all get solved. Got to prioritize. You're never working on more than 3 unsolved problems at any particular given point in time. The ones you've decided are not going to be worked on right now, you are handling with Plan C. Those expectations have been removed for now. Forever? No, for now. When will those expectations come back? After we've solved some of our higher priority unsolved problems. That's Plan C. Prioritizing. Now, in the case of the very volatile, unstable, reactive kids that I tend to like working with, Plan C is also about stabilizing. Because any expectation you've removed for now won't set in motion concerning behaviors because the expectation has been removed for now. Which would I rather use to stabilize a kid? Plan C or an atypical antipsychotic medication? Definitely Plan C. It has no side effects. Am I allergic to using medication for the purpose of stabilizing kids or for some other purposes? No. But I'd rather use Plan C. If Plan C would get the job done, I'd rather use Plan C than medication. That leaves us with only 2 other plans. Matt, go ahead.
Well, I just wanted to, we got a question that came in that I think is relevant here because, we're trying to set these, you said 3 at a time, right? So we're trying to set the behaviors or we're trying to set the problem, that we want to address. What do you recommend people do when the schools are fixated on challenging behaviors and not addressing the problem causing the behaviors? And so that's, at conflict with what you're doing at home and also can increase the child's anxiety or whatever else might be going on.
I wish it was a simple answer. My pat response is find the person in the school who you think will be most receptive to these ideas and ask them to give you the lay of the land. Ask them how to make this happen. And the reason I can't give you sort of a more algorithmic response is because every school is different. The hierarchies in every school are different. The politics in every school are different. Find a person in the building who can give you the lay of the land and help you strategize. I will say this, if this is going well for you at home, you've got a leg up because you can let people know, look, we're doing something at home that I think might benefit you all at school. We're not having these challenging behaviors at home anymore because we stopped focusing on the challenging behaviors and started focusing on and solving the problems that were causing those behaviors. You've got a leg up. If you've got it going well at home, that's leverage. But that's the answer.
Okay. One more before we move on. What if your child is nonverbal? Sometimes it can be a challenge to find out what that problem actually is. You're seeing the behavior, but you might not be able to ask or understand what that problem might be.
Well, you're going to use your observational skills. It's the adults who are figuring out what expectation the kid is having difficulty meeting. That's what the behavior is telling us. But here's the interesting thing. You don't even have to focus on the behavior. Focusing on the behavior to figure out what expectation the kid is having difficulty meeting is what I call going through the back door. Go through the front door. Just make a list of every expectation your child is having difficulty reliably meeting. You've left the behavior out. So the way you're not doing it is saying, oh, he just started screaming. I wonder what expectation caused him to start screaming. You don't got to do it that way. That's the backdoor approach. The front door approach, just figure out what expectations your kid is having difficulty meeting. Keep a list for a week of every expectation your child is having difficulty reliably meeting. That's your list. You don't have to focus on the behavior to help you figure out what expectations the child is having difficulty meeting. That it for questions so far, Matt?
Yeah, I think we're good for now. We got some more, but I think you're going to touch on some of these topics as we move, so I'll throw it back over to you.
Got it. That leaves us with only two other plans, A and B. Both represent a way to solve a problem with a kid. There is just one massive difference between them. With Plan A, you are solving the problem unilaterally. With Plan B, you are solving the problem collaboratively. You're almost never using Plan A in this model. The way you're solving problems in this model is Plan B. Are we allergic to Plan A in this model? No, we're not allergic. We just don't think it's a very good idea. But if a child is about to dart in front of a speeding car in a parking lot, you're not doing Plan C. You're not saying, you know what, we got bigger fish to fry. You're not doing Plan B. You're too late. Plan A. You yank on the kid's arm. You save his life. If he blows up, so be it. But if 3 weeks later, the kid has now darted in front of a speeding car in a parking lot 17 additional times, and you've yanked 17 additional times, yep, I'll agree with you. Plan A is working at saving the kid's life, but Plan A is not working at solving this problem. You're going to need a different plan. And if you decide, you know what, I don't think my kid is capable of appropriate parking lot comportment at this point in my kid's development, or if you decide I got bigger fish to fry here, you're going to do Plan C. And if you decide this is very important at this point in my kid's development, and I believe that my kid is capable of it, it's a high priority, you'll be doing Plan B. A is saving your child's life. It is not solving this problem. All right. Really kind of just one more thing to cover. What are the 3 steps for solving a problem collaboratively and proactively? One more thing to cover in terms of technicalities. The 3 steps are called the empathy step, the define adult concern step, and the invitation step. What I always tell people is that the names of the steps don't matter so much. The ingredients matter a great deal. What's the main ingredient of the empathy step? Information gathering. Gathering information from who, about what? Gathering information from the child about what's making it hard for the child to meet a particular expectation. We need info. The empathy step is where we get it. Even going back to an earlier question, if the child is completely nonverbal, even if the child is having difficulty putting their thoughts into words. If any of the questions that we talk about in our last 12 to 15 minutes here are about those kids, I'm happy to talk about the many, many different creative ways that it's possible to help kids who are compromised in the language processing realm participate in solving the problems that affect their lives. Because if we decide that these children are not capable of participating in solving the problems that affect their lives, then we have written them off and relegated them to approaches that are purely aimed at modifying their behaviors and using adult power to get these kids to do what we want them to do. I haven't met that kid yet. That's not how I do it. Second step, the define adult concern step, that's where us adults are entering our concern into consideration. By the way, let me go back to the empathy step for a second. Be prepared for surprises in the empathy step, where you discover that what you thought was making it hard for your kid to meet a particular expectation is not what's making it hard for your kid to meet a particular expectation. Good case in point, I've been telling this story a fair amount lately. I was doing a podcast with the father of a 3-year-old girl maybe a year ago, as best I can remember. And he was telling me that she was having difficulty brushing her teeth before going to bed at night. But he thought he already knew why she was having difficulty brushing her teeth before she went to bed at night. He was sure it was the taste of the toothpaste. He was telling me 8 to 10 different flavors of toothpaste later, she was still having difficulty brushing her teeth before going to bed at night. So finally, he said he did the empathy step. And what did he learn from his daughter? That when he used the electric toothbrush on her teeth, it got water all over her face. And she hated that. As I said to him, there's a concern 8 to 10 different flavors of toothpaste could never address. The define it all concern step is where the adult is entering his or her concern into consideration. What are we adults usually concerned about? How the unsolved problem is affecting the kid, and or how the unsolved problem is affecting other people. What did the father say in response to that? Well, he didn't want her to get cavities because how is it affecting her? It hurts to get them filled. How is it affecting him? It costs money to get them filled. Finally, the invitation. This is where caregiver and kid are putting their heads together, collaborating on a solution, but a solution that must meet 2 criteria. Got to be realistic. Both parties got to be able to do what they're agreeing to do. Got to be mutually satisfactory, meaning the solution truly addresses the concerns of both parties. You are giving the kid the first crack at the solution. Here's what the invitation sounds like. I wonder if there's a way for us to do something about you not liking getting the water on your face when I'm brushing your teeth with the electric toothbrush, and also make sure that you're not going to feel pain by getting cavities filled, and I'm not going to have to spend money I don't feel like spending to get them filled. You're giving the kid the first crack at the solution. You got any ideas? They usually do. This 3-year-old did. She said, maybe we could wrap a towel around my face when you're brushing my teeth with the electric toothbrush. She brushed her teeth. She didn't get cavities. Her face didn't get sprayed on by the electric toothbrush. Now some very important questions. Who won? Both. Who lost? Nobody. Is the father still an authority figure? A whole lot more of an authority figure than he would have been if he was using power and control to get his daughter to brush her teeth. Are the inmates now running the asylum? Absolutely not. And did he just take one giant leap forward in helping enhance his daughter's skills in the departments of empathy? Well, he's modeling empathy, number 1, in the empathy step. She's showing him empathy in the define it all concerns step. Has she acquired some skills in the domains of taking another person's perspective and appreciating how one's behavior is affecting others? That would be the define it all concerns step. Are they resolving disagreement without conflict? That would be the invitation step. Goodness gracious, there sure are a lot of skills that are being modeled and practiced in those 3 steps of Plan B. So let's just be clear. You're not only doing this once. This is how I recommend you solve problems with kids. So we have a few other slides that we could go through, but I'm going to not go through them just yet. And we don't even have to. Matt, I'm sure that we have a lot of questions.
Yes, we do. And a lot of these are about this step, clearly about the collaborative process here, the Plan B. And some of these were submitted before you went through it fully. So there's potentially some of that. But do you find that this how do you suggest, if you know your child has ODD or is in that defiant category, applying this? Is it exactly the same for every child? Are there tips for when you're dealing with somebody who you know is on that spectrum of defiance?
A child's diagnosis would have very little influence on how I would do these 3 steps.
Okay.
If a child, for example, was diagnosed with ADHD, I might anticipate, I might be proven wrong here, by the way, I might anticipate that the child might have difficulty sustaining attention or sitting still through the entire process in one sitting. But there's a whole bunch of ADHD kids who are intrigued by this process and have no difficulty whatsoever sitting through the process and paying attention to it. So I don't want to make any generic statements about what this model would look like because of a diagnosis. One kid at a time, you're going to meet your kid where your kid is at, irrespective of what diagnoses have been applied to your child so far.
Okay. I have another question from someone who says that they've tried this. So they've tried collaborative problem solving. No matter what they've come up with, their child has failed. Their question is, how long do you keep going back to the well? And they wanted to point out that the skill that they're working on is one that the child has exhibited they can do. And they seem to be choosing not to do that skill.
Well, number one, why would they choose? Number one, you're not actually working on lagging skills explicitly in this model. So I want to make sure we're not confused here. What you're working on in this model is unsolved problems, not lagging skills. Now, that caregiver didn't tell us what lagging skill it was. Maybe they were just using the term lagging skill to apply to an unsolved problem. But that's point number one. What you are solving in this model is problems. You are not working on lagging skills explicitly in this model.
Right.
Believe me, the lagging skills will be enhanced, but by working on the unsolved problems and solving them collaboratively and proactively. Now, the fact that the child is sometimes able to meet a particular expectation does not mean that the child can meet that expectation reliably. And what I often find is that when we say the child is choosing not to, that's usually just proof that we don't yet know why the child is sometimes able to meet it and sometimes not. Why would we jump in with these choosing not to when we really could say, you know, I really haven't talked to my kid yet about why they're sometimes able to meet that expectations and sometimes not? That's the conversation that needs to be had. Now, as it relates to the last point, I don't know why the solution's not working. The main reasons solutions don't work is because they weren't as realistic as we thought they were, and or they weren't as mutually satisfactory as we thought they were, or because we were working on a skill instead of a problem. That will take us down the wrong road, or because we gave the empathy step short shrift and only heard about a few of the kids' concerns related to meeting that expectation, but not all of them. So as you can tell, and I'm not even being exhaustive here, there's lots of reasons that a solution might not work. But I don't think we should call that a failure. I understand that if you've been working on this unsolved problem for a long time, that might be frustrating. But there's always a reason that the solution isn't working. So I wouldn't abandon the plan B ship. I would try to figure out, how come this isn't working for us yet? And I've just listed a few of the reasons why it might not be working.
Okay. So we have some questions about some ASD-specific items. Sensory processing disorder, like brushing with paste. They have a 12-year-old. I think it's a little bit different than getting water on the face as it relates to the last story that you told. So when it comes to these sort of concerns, how do you look to apply this to that?
Well, the first thing I would say is that there are kids who are not on the autism spectrum who have sensory issues. So that is not purely the domain of autism. But all that says is that the kid's concerns are different than the concerns of the kid in the story I told. The kid's concerns still need to be addressed. If they have trouble using paste, then the question would be, what are the adults' concerns about that? Do they feel it's important that paste be used? Going back to something I was talking about very early on, if the adults do not care if paste is used, we don't have a problem because the adults don't care. If the adults do care if paste gets used, if that's an expectation they feel it's important to meet, they have to know why it's important for that expectation to be met. Probably related to paste helps us prevent cavities, probably related to fluoride, probably there's other ways to get fluoride onto teeth besides paste. We've just opened up a universe of solutions here, even though what the kid's concern was different than the one in the story that I told about teeth brushing.
Okay. We've got a complicated one, potentially. A child often doesn't know why he does what he does. He has combined ASD, ADHD, some anxiety diagnosis at a very young age of 5. Despite being very alert, collaborative, and empathetic, if he is not receptive, how are we supposed to problem solve with him? They found medication has helped them to a certain extent, but
the number of diagnoses does not make this kid complicated. You still have unsolved problems. But if you are talking with your kid about what he did, and I'm using your words explicitly, that's not working on unsolved problems. That's working on behavior. And that would be my first place that I would guess as to why the child is not participating in the process. Because what I find is that when we talk with kids about their behavior, instead of about the problems that are causing their behavior, they think they're in trouble, they become defensive, and they often won't participate. So just based on me glomming onto the words that you used, let's not talk with your kid about their behavior. You're not talking with your kid about hitting anymore. You're talking with your kid about the problems that are causing your kid to hit. In this case, I don't know what those problems are. We need to identify them. Once they're identified, we won't get distracted by the behavior anymore, and we have something completely different to talk with the kid about.
So talk to the kid. We said this, and we brought this up earlier on, but what are the strategies for nonverbal children in trying to come up with collaborative solutions?
Oh, there are so many. First of all, if a kid is unable, for whatever reason, to tell you what is making it hard for them to meet a particular expectation, a very common strategy is guessing. You'd rather hear it from the horse's mouth, but if the kid is unable to tell you, guessing is a fine strategy. Educated guessing, hypothesis testing. If the kid isn't responding to that because it still requires a verbal response, I often teach the kid 5 fingers. 5 means very true. 4 means pretty true. 3 means sort of true. 2 means not very true. 1 means not true at all. And then I make statements, which are my theories, and all the kid's got to do is hold up fingers to let me know how true the statement is. If 5 fingers is too many, I'll go with 3. If 3 are too many, I'll go with 2. If fingers are not the kid's gig, I'll go with sticky pads. No, I promise they weren't handy just because of this webinar. They just sit on my desk. With yes and no or true, false on the sticky pads. And all the kids got to do is tap. And now the lines have just blurred between kids who can talk but aren't and kids who can't. In the case of kids who can't, they are frequently these days using assistive technology. We can put yes, no on the home page of their tablet and have them point. We can use sign language. We can do pictures. There are many, many, many ways to communicate with kids who are nonverbal and assist them in participating in this process. The limit, quite frankly, has more to do with our creativity and our insistence that they communicate through our preferred modality, the spoken word, than it does whether these kids can actually participate in the process. Boy, I can't tell you how many kids I've worked with who we got information that no one ever knew. And some of these kids were 17 years old.
Wow.
Through strategies like the ones I just mentioned.
Excellent. Well, Dr. Greene, we've got a minute left. Is there anything that you didn't touch on today that you want to make sure that the audience gets before we depart?
Super quickly, it is a myth that parent-child conflict is inevitable. That's a myth. Parent-child conflict, caregiver-child conflict is not inevitable. Parents and kids are going to disagree with each other, and kids are going to have difficulty meeting expectations. But that doesn't mean that conflict has to be the result. It all depends on how you're going about solving those problems. The myth, you're not an authority figure if you're not using Plan A. You are very much an authority figure when you are using Plan B without the massive downside of Plan A. And finally, do you still have expectations? This is one of the great misconceptions about this model. Do you still have expectations in this model? Of course you do. You can't raise kids without expectations. You can't run a classroom without expectations. Now you all know, it all comes down to how you're trying to handle unmet expectations. That's where the rubber meets the road. Plan A causes conflict. Plan A is about power. Plan B is about collaboration. Collaboration brings people together. And I think that is a fine place for us to end, except for the websites. Thank you very much for inviting me to do this.
Thank you, Dr. Greene. I appreciate it. It was very informative, as always. We got a lot of the questions answered. There's a few that weren't. You might hear from Autism Ontario on that. And with that, guys, like Dr. Greene said, we've got the Lives in the Balance website in the handouts. Click on that, bookmark that site. We also have a link to books by Dr. Greene where a lot of this gets all wrapped up and summed up. You can also grab the PowerPoint in both official languages. And since this is the last official Autism Ontario webinar for the rest of the year, we've linked to the on-demand webinars. We've had a great season this year. We moved out of the studio. Clearly with COVID, we went remote like this, and we got to have some amazing guests just like Dr. Greene all year long. So go ahead and click on that link to check out some other events. Autism Ontario will be promoting them. This event itself will be available on demand on this URL at some point later on this afternoon. So you can feel free to share this link with your friends, family, loved ones, anyone you think might benefit from this webinar. I know this one goes well beyond ASD and the like, and it is a very informative one. And then it will reside with all the other on-demand webinars on the Autism Ontario website. And since I won't be seeing you guys, well, I don't really see you, but since we won't be talking to you guys until 2021, have a great holiday season. Thanks so much for your participation in this and all of the things that we do. And we look forward to seeing you at our next Autism Ontario event.